Hi, this is Alfred Brock, and we're taking a look at being in the know about prescription drugs. Prescription drugs. A very serious issue in the United States is people using prescription drugs either unwisely, incorrectly, or illegally. An example of using them incorrectly is if the package says take such and such as needed, right? That doesn't mean that you need to take it all the time. You just take it when it's needed. When you're done with it, then you stop. Americans have a tendency to follow exactly to the letter the instructions that their doctors give them and may sometimes disregard that as needed. So they get the little capsules and they take them on a regular basis, every 4 hours as needed. So they read that as take it as every 4 hours until they're all gone. This is okay for a lot of drugs, but some of them, like opioids, if you do follow that, your body can become dependent upon it, and you would like to avoid that. Because at the end of that, if your body has become dependent upon it, or if the prescription was long enough and high enough, have actually developed an addiction to it, your body has actually developed an addiction to it, and you wouldn't necessarily know this in your mind, but your body would know it and would want to have that. If the affliction has alleviated or the pain's gone away, now you're going to get pain because you don't have the drug anymore, which is a mistake we don't want to make. Because then you'll be asking for the drug not to alleviate the pain or take care of the problem that you had, but to ensure that your body feels okay with the continued administration of this drug. So let's read through this. We've got prescription drugs is an American epidemic, right? Most people who use illicit drugs abused prescription drugs first. Opioid prescriptions are up 400% in the last decade. 80% of abused prescription drugs come from a relative or friend. What does that mean? Well, they may have been stolen, they may have been provided to them, they may have lent it to them or whatever, oh, I've got some left, you can have that. Or they were sharing them for fun, right? So opioids are intended to relieve pain, and these include codeine, morphine, methadone, fentanyl, oxycodone, hydrocodone. And they may cause drowsiness, constipation, respiratory failure, and addiction. Now for depressants, to reduce anxiety, there's Valium, Xanax, Seconal, phenobarbital, Ambien, Lunesta. And these may cause slowed brain function, slowed heart rate, respiratory failure, and addiction. Stimulants, which are used to raise alertness. These include Ritalin, Vivance, Dexedrine, Adderall, and Concerta. These may cause anxiety and paranoia, high temperature, irregular heartbeat, and seizures. So that's what I was reading off right here. It's this little chart. Trying to get that focused in. There we go. Let's continue. Now, no prescription. Using medications not prescribed to you, giving them to someone else, or misusing your prescription is dangerous and it's illegal. It's dangerous. No person should not be doing that. No giving them to someone else or sharing them. You can't say, oh, I've got some in my drawer over here if you want one. Or, you forgot yours, you can have mine. Because there could be a difference in manufacture, there could be a difference in the level of drug in the pill. And it's, person gets prescribed something specifically for them, their condition, and their body. You don't want to share your medication with somebody else. Abuse and addiction. Medications are effective when properly used, but they can be dangerous and addictive, especially when abused. So if they're used too long or used incorrectly, addiction can occur and will occur with opioids over a certain period of time, which can be up to 20 to 30 days, or even less in some cases. Dependency begins within 7 to 12 days, and within 20 to 30 days, an addiction can set in. Certainly, if the person is taking them up to 60 days, and the body becomes addicted to it and needs that in order to function in certain ways. It's very, very strange. Drugs and alcohol. Alcohol should never be mixed with prescription drugs. Most overdoses are because drugs and alcohol are mixed. So if you're taking the drugs, cut the alcohol out, because you're just risking your life. Signs of abuse include, signs of abuse. Drug-seeking behaviors are the primary indicators of prescription drug abuse. So if the person is seeking the drug through channels that are not normal and they've exceeded their prescription rate or whatever, drug-seeking behaviors are the primary indicators of prescription drug abuse. These would include frequent refill requests, borrowing prescriptions from others, taking larger doses than prescribed, seeing many doctors for the same condition, stealing or foraging for drugs, lying to questions about prescriptions. Now, what do you do if you've got some drugs in the house and you don't need them anymore? You took them as needed and you still got some left over. Well, disposing of prescriptions in a safe manner helps prevent abuse. They're not laying around the house, they're gone. And they're in a safe place and they've been destroyed. Follow disposal directions on the bottle and use common community disposal drop boxes, and that'll gather them in one place so they can be taken away and destroyed. And do not flush medications down the toilet, as they can enter the water stream and cause all sorts of strange things to occur, not only to invertebrates, fish, and other animals that drink the water, us included. We need to avoid that. We don't want to poison the water supply. Getting help. There are support groups and other ways to get help with prescription drug abuse. Talk to a counselor or your doctor and get on the path to recovery. Refuse to abuse. So right down on the bottom. There it is. All right. If you're in Southeast Michigan, there's a phone number to call and a website. Thank you for your time and attention. Live healthy, live happy.